Abuse and illicit trafficking. Let's cross over live to the United Nations headquarters in Gigiri, where the World Drug Report is currently being released. Nairobi Senator Johnson Sakaja is among the leaders who are present at that event. Let's hear what he had to say earlier.
Because many people are accessing these drugs from our pharmacies across the country, over the counter. And so we want to really put these pharmacies on notice. You know, drugs like tramadol, which is an opioid, used to treat pain, a lot of other pain meds. People are accessing. There's too much, you know, it's almost like a classical approach to drugs. You know, you just go there with a prescription and you're getting it. And it is going to become an epidemic. So we're putting them on notice together with the Pharmacy and Poisons Board to actually, you know, pull up their socks and make sure that there is proper regulation of all these pharmacies and chemists across the country. Secondly, I want to concur that some of these drugs are actually being, you know, spread through recreational areas. We know that Kenya has been a corridor for trafficking, and what we have is the cookie crumbs. I think that's what is the word that is called. The spillover of these drugs that are finding their way. A lot of them have been in these gambling dens, and we've seen that there's already been an approach to get rid of illegal gambling dens. We know some of the establishments. I know some of them in Nairobi, in Mombasa, in Kisumu, where young people are actually being exposed to these drugs. We are saying that this must stop. This must end. Even in these mirror dens where there are people below the age of 18 consuming cat, consuming what we call mogoka, you know, at the age of 15, at the age of 16, we're going to put renewed energy and focus in stopping those and making sure that this country remains drug-free. So we've committed ourselves to support legislatively, to create awareness. In the next few weeks, we're going to have a meeting with the entire Senate and the United Nations Office on Drugs and Crime to sensitize senators, even as we go to implement this within our counties. We've seen the need, again, for focus on mental health. You know, health is a devolved function, but there's not been enough focus on our young people who are depressed, our young people who are going through mental issues. We don't have enough personnel with the capacity and the training to deal with this. We've seen a lot of suicide, you know, attempts and even successful suicides going up. And all of these have one thing or another to do with drugs. So we're renewing that focus. We want to thank the UNODC because they've committed to support us in this work, not just in Nairobi, but across the country. And finally, all of these, as I've said before, depend on what we do for our young people and our women with respect to economic opportunities and economic activities. Out of the 18,000,
and it is also true that Kenya is a market, you know, for these drugs. And the most, you know, appalling thing is the twinning of drug money and politics, where you have drug barons being able to occupy public office. And now, you know, distorting democracies. This is something that we need to confront, because you cannot prey on the lives of young people, the workforce of a people, to the benefit of your own political advancement. Then you use the popular will of the people to protect yourself. I think this report has come in timely. And in the past, we have seen even names of individuals being, you know, listed as being involved. And this is what we need to come in the limelight, so that then we know the real culprits who are behind this trade. But also at the international level, and this is my second and last point, is that we are seeing trade protectionism. We are seeing countries, you know, pulling back. And these dark webs and illicit financial flows are going to increase if there is no international cooperation. We are seeing a discord at the international community. And I think this is something that needs to be addressed. We need a committee of nations to help in the fight against drugs. Otherwise, if each and every country decides